Hello, I'm Gail Hogan, and it's my pleasure to introduce this overview of physician career opportunities at Riverside Radiology and Interventional Associates, Ohio's premier diagnostic imaging and interventional radiology practice. Located in Columbus, Ohio, the group consists of more than 65 subspecialized radiologists who have trained at some of the nation's leading medical centers. Together with a staff of experienced allied health professionals, the Riverside team is dedicated to maintaining a culture that is conducive to personal and professional growth. Ranked 11th by Radiology Business Journal's 2009 50 largest private radiology practices in the nation, the physicians and staff from Riverside Radiology and Interventional Associates have earned their reputation as the radiologists that Ohio doctors trust. The group's accomplishments include being named by Columbus Business First as a 2009 Best Places to Work Award winner and a finalist in the 2009 Tech Columbus Innovation Awards program. The group also serves as the official radiology group for the NHL franchise, the Columbus Blue Jackets. And in early 2010, Riverside Radiology and Interventional Associates joined Strategic Radiology, a national network of large clinically advanced groups that are geographically dispersed. This commitment to surpass national standards sets the bar high and keeps the group at the leading edge of the healthcare industry.
We're a subspecialized group so that they're able to practice their subspecialty to a greater extent than they would in other practices.
We're very subspecialized in that we have radiologists that do musculoskeletal radiology like myself, and we have others that do interventional radiology and neuroradiology and so forth.
We were able to subspecialize due to the fact that we were a larger group, and I thought that was an important aspect. In the area that I wanted to practice was one that enabled subspecialization.
Most of our radiologists are subspecialized, and I think we tailor our exams and develop new protocols and work with the equipment that is at the cutting edge, state of the art.
The group itself is probably changes more than any other group I know, and this practice, interventional practice, is probably one of the most dynamic in the country because all of us do sort of interventional per se, but we also have our specialties.
We're probably in the top 5 stroke intervention programs in the country as far as the volume of cases that we do.
Our neurointerventional program here is one of the top in the country, and it's had very good outcomes compared to major academic institutions, so we're very proud of that and continue to build on that model.
We've had great support from our interventional partners and from the diagnostic radiology partners because they see this as a good thing to invest in and spend time on, and the hospital has agreed with that, and so it's been a good synergy of the physicians, the radiology group, and the hospital coming together to make a very good thing.
The types of experiences and types of procedures that we do extend from the most basic to the highest level.
We do just about everything. I'm not sure that there's really anything our practice isn't involved in.
As far as intervention goes, we have 2 or 3 interventional neuroradiologists that are doing pretty much everything that anyone else is doing. Our body interventionists lead the country in what they're doing. We have one of the biggest groups out there.
It's very unusual to have this many good interventional radiologists in the same practice from so many excellent institutions.
With one of the bigger groups, with one of the more progressive groups, with one of the more IT-connected groups.
The size of our group, I think while it can be intimidating at first, I think is actually very comforting in the end because there's a lot of resources available. There's a lot of people that you're able to discuss cases with, and there's a tremendous amount of collegiality and rapport among our physicians that I think puts people at ease once they start a practice.
When I came in 93, 94, we were about 12. I think I was the 12th doc. And so now we're 70. So you can see the growth has been explosive.
We've certainly been continuing to expand since I joined the group 3 years ago. But despite its size, it still was a very friendly atmosphere.
It's obviously harder the more people you get to get everybody to agree, but our group's done very well at that. I think because everybody kind of has their role to play, it works out well.
We have a great group of people, great leadership in our practice, and also the relationship we have with our ancillary staff, the technologists, the nurses, what have you, and our physician colleagues.
The staff have been tremendous. I think they've recognized it's been a small business growing together, and they feel very dedicated to pleasing the type A, high expectation doctors, and they've met that challenge with a lot of gusto.
Whenever you're working hard towards the same goal, there's a type of a common appreciation for each other that builds over the years. And without a question, it is a very good, tight-knit family here.
people, you know, treat each other in this practice with a lot of respect.
I think our group has great collegiality. We all share cases and have fun with each other. We all work very hard. We're all very driven to bring the best technologies to our physicians and our patients.
I think the consistency, the high level of care, our commitment, our passion, and just taking a personal interest in each individual patient makes us stand out from other groups.
I think, you know, we've always placed our relationship with our referring physicians, in addition to our patients, as being, you know, paramount for our success.
Everybody kind of has their role to play, and we kind of function as a team, so everybody's doing what's best for the patient as well as the referring docs. Works out well, I think, for the patient and also the referring physicians.
The best thing you can do is just take care of their patients well. And if you do that, referrals tend to keep coming.
We can provide a service to help that patient get back and feeling better as soon as possible and help the referring doc treat them. I think that's probably the most rewarding part of what I do.
It's really a wonderful place to practice, and you know, I look forward to work every day. And each day holds a new set of challenges and adventures, and I think that's what keeps me going every day.
With great people, amazing technology, and world-class service, as well as a tireless commitment to staying on the leading edge of diagnostic imaging and interventional radiology, the physicians and staff of Riverside Radiology and Interventional Associates have created an environment to challenge your medical expertise, share in best practices, and deliver ongoing career development. Thank you for taking a few minutes to learn more about the physician career opportunities available at Riverside Radiology and Interventional Associates. I'm Gail Hogan, and it has been my pleasure to introduce you to these spectacular people creating amazing opportunities.